So now I'm going to introduce our third and last speaker for this evening, no other than Professor Zulkifli Ismail. Professor Dr. Zulkifli Ismail is currently the Secretary General of the Asia Pacific Pediatric Association. He was formerly the President of APPA from 2012 to 2016. Currently, he is Chairman of the Dengue Prevention Advocacy Malaysia and Immunize for Life. He is a clinical professor at KPJ University College of Health Sciences and consultant pediatrician and pediatric cardiologist at KPJ Selangor Specialist Hospital and a visiting pediatric cardiologist at KPJ Damansara Specialist Hospital. He is also editor of APPA Bulletin, Berita MPA of the Malaysian Pediatric Association, and chief editor of Positive Parenting, a quarterly publication aimed to equip Malaysian parents with reliable and practical local information on maternal, child, and family care. Colleagues, let's all welcome Professor Zulkifli Ismail, who will discuss approaches to increasing vaccine confidence nationwide, sharing their experiences in Malaysia.
Thank you. Thank you very much, Jocelyn. I hope you can see my slides.
Yes, very clear.
Thank you. What I'm going to talk about is actually about increasing vaccine confidence. And Anna has given a very detailed and excellent talk on vaccine hesitancy, which I can skip in the beginning of it. The title that I've been given, or that Lillian has given, is Increasing Vaccine Confidence Nationwide. And I'm actually giving a similar talk in this conference, which is the 10th Asian Vaccine Conference to be held in Malaysia, in Penang, in October. So this is an invitation for all of you as well. We know that vaccines have made the world safer. Since 1980, we've had no cases of smallpox already, but we still have a problem with vaccine hesitancy. And Anna has gone through in great detail about what that is all about. And the vaccine hesitancy and vaccine refusal is not something new. As Anna has mentioned, is from the time when Edward Jenner first started the smallpox vaccine, and many actually opposed because of a distrust in medicine, as well as liberty issues, as Anna had mentioned earlier. So it makes it very much easier for me to give this talk. And the vaccine hesitancy and refusal has actually multiplied many times because of social media and also the internet. And social media has given people who are either experts and non-experts to give factual and non-factual information. And it's difficult for us to sometimes, when you key in vaccines and vaccine or vaccinology, you get your first few 10 or 20 websites will be on vaccine anti-vaccine websites. So these are all taken from the website from anti-vaccine website. So it's nothing new, right? And the vaccine hesitancy and refusal are actually causing the return of diseases that vaccines could prevent in the past, and this will be like measles, pertussis, diphtheria, tetanus, poliomyelitis, TB meningitis, to name a few. So vaccine hesitancy and refusal actually can be influenced by what we know usually, and we talk about, is actually on the individual level, which means low awareness of the vaccine, fear of the side effects of pain, and low parental education, as well as low socioeconomic status. But there are other issues that are above this that also determine whether the individual is going to be hesitant or refuse vaccination. And institutional, where you have low confidence in the healthcare, if the healthcare staff is not well trained in vaccine advocacy. And interpersonal relationships, where the mother makes the decision and is the maternal decision-making that makes a difference, as well as the social connectivity between individuals, either on a personal face-to-face basis or as on the internet. Now, there's also in the community there will be misinformation and rumors that we may have to deal with, as well as religion and culture, which forms a big part of it in a lot of countries, especially places like Malaysia, Indonesia, and probably also in the Philippines. And then there's of course policy, where there's vaccine introduction, as well as geopolitical conflicts, and also mandating vaccination. So this has been shown earlier that what Anna had said, that the WHO has put vaccine hesitancy is one of the 10 threats to global health in 2019. And Anna has also shown the Vaccine Confidence Project, where it stated that vaccine confidence is shaped by beliefs, emotions, ideologies, and social contexts, things that go beyond the influence of trust and acceptance. Now, in an increasing vaccine confidence among the public, you need to first build the trust, and establishing a trust through a transparent communication as well as consistent messaging is important. And we need to empower healthcare professionals. So healthcare providers will need to be trained and supported so that they become effective vaccine. They can have effective vaccine conversations with their patients or clients. And we have to engage communities, working with community leaders and organizations to address the local concerns and misinformation. And we have to combat misinformation and disinformation as well by countering them with accurate evidence-based information that had been shared by Anna before. And then provide a vaccine benefit promotion, which means that we have to highlight the benefits and safety of vaccines through various communication channels. So immunization advocacy is the key. So healthcare professionals or healthcare workers are the most credible, they're the most trusted of people in our community, and they have to be trained, and they have to have, and this will have a structured and well-organized advocacy machinery, which I will try and share with you later on. So building an immunization reference center is actually a trusted, independent hub that provides accurate information, resources, and support to both the healthcare professionals as well as the communities, so that it can strengthen vaccine confidence and uptake. And what should a vaccine reference center be able to do? They should be providing reliable, evidence-based vaccine information that's tailored to both the healthcare professionals as well as the public. And they must be in a position to debunk myths and misinformation by offering clear, easy-to-understand explanations. They should support advocacy efforts, and this meaning that they have to actually prepare material for healthcare professionals, for community leaders, and for advocates to train with. And then they have to facilitate two-way communication, which address public concerns and gather feedback to improve these strategies. The fifth role is actually to act as a collaboration platform, which links government, NGOs, healthcare providers, and community groups. Now, the characteristics of this reference center, or a specific reference center that will actually disseminate information nationwide, has to be trusted and credible. And it has to have, it should be accessible and should be inclusive, and it should be clear, the messaging should be clear, and it should be user-friendly, it should be independent and impartial, and it must be sustainable as well as visible. And collaboration with other partners is essential as well. So how do we make advocacy effective? So effective advocacy requires the right messenger. That means it requires the right messenger, stating the right narrative with the right delivery and the right reasoning. And the right messenger will usually be community leaders, influencers, as well as familiar voices more than officials from government. And the right narrative means it focuses on family, faith, and future, and not just on statistics. So basically, it uses emotional, attention grabbing, and storytelling. And the right delivery means advocacy must be active, open, credible or believable, independent, and sustainable. And they need to see it and feel it's real. And the right reasoning means you simplify complex science and share relatable everyday stories that make sense to the public. I want to share what we're doing in Malaysia. This is a tripartite collaboration in vaccine advocacy involving the government, which provides credibility, the professional bodies that provides the technical expertise, and industry for financial support. And this is called Immunize for Life and is supported by a Health Communications Secretariat service at the bottom. Now, what it does is actually it's an expert-driven community education program that's developed to support the WHO's call to increase vaccination promotion among member countries. And the audience are young parents and childminders, adults, which includes travelers, the elderly, healthcare workers, pilgrims, and food handlers, meaning the whole spectrum from womb to tomb. The goal is to position immunization as essential to personal, family, and community health, and also to help curb vaccine hesitancy and refusal. The website is there. It's just simply www.ifl.my. Very easy to remember. And it's been over a decade since we've been in existence. And it was launched in 2013. And I'm showing this photograph not to show that I was at the launch, that I organized it, but to show you the people who we invited. The National Fatwa Council Chairman, who is in charge of making religious decisions. The Pharmacy Division of the Ministry of Health. This is to get buy-in from the Ministry of Health. And we had successful media presence because we had celebrity involvement as well as a VIP patron who is, as you know, is the wife of the Prime Minister who just celebrated his 100th birthday and became Prime Minister twice in our country. So we got her involved as the patron, and that's been very successful. So this slide is just to show we used everything in the textbook to make it appealing to the public. And the scope of Immunize for Life is to educate on life course immunization, to promote compliance with the National Immunization Program, and what we call the additional recommended vaccines. And what you will call optional vaccines, we changed that terminology and made it as additional recommended vaccines so that it doesn't become an option, it becomes a recommended one. And then we have we also facilitate adult immunization, we support introduction of new vaccines, and we address vaccine hesitancy and refusal. And also we're involved in outbreak responses, especially when it came to COVID, and when we had the outbreak of diphtheria in the state, as well as the outbreak of measles in the state of Sabah, we helped with that as well. Now, in order to provide proper governance, we have a management committee that I chair, and the management committee is represented by the Ministry of Health Education Division, the Health Education Division, the Disease Control Division, the Family Health Development Division, the Malaysian Pediatric Association, NGO, as well as the Malaysian Society of Infectious Diseases and Chemotherapy. And we have strategic meetings that are actually strategic planning, where we actually are proactive as well as reactive, and we have coordination and monitoring as well as evaluation and improvement. Now, the committee that I chair actually reports to the Deputy Director General of Public Health, and the Director General, and then I report to the Minister but once a year. And the important part is the Program Secretariat at the bottom that actually does the running around. Strategic partnerships cannot be understated, because we have made partnerships with medical organizations on your lower left, which includes the Malaysian and Medical Association, the Family Medicine, the Malaysia Influenza Working Group, the Endocrine Society, because we talk about influenza vaccine and talk about diabetes, and we link up with NGOs and industry associations, which are the Kindergarten Teachers Association, because we need their dissemination, their contacts on the ground, as well as the University of Third Age. Now that is the Senior Citizens Association. So the ones at the top, and that is all the senior citizen associations. We do that because we need them to promote the influenza vaccine among the senior citizens. And from the campaigns that we've had organized so far have been involving influenza vaccine, vaccination for pilgrims, adult vaccination check, as well as HPV vaccination, the Immunize to Protect for rotavirus and chickenpox vaccine, COVID-19 vaccine, as well as the latest one that we did was the catch-up program for pneumococcal conjugate vaccines. So these are all the campaigns that we have done under the Immunize for Life batch. And with educational resources, there are over 270 videos in English as well as in the Malay language that actually discusses different aspects of disease, vaccine preventable diseases. One of which was my interview of my childhood friend who had polio, and he agreed to do that interview with me. Then there is the social media platform, where we have on Facebook as well as on Instagram, and we own the media, so we determine the narrative. It's actually cost effective, it's targeted, measurable, and we can use it as an avenue to counter vaccine misinformation online. We use it a lot to do that as well. Then news media is awareness to the news. We actually still use the newspapers and all that, and we build familiarity by presenting facts and views, and this can amplify issues and sustain the discourse over a period of time, and it maximizes reach through multiple platforms. Website is our Immunize for Life website. So if you actually scan the code or the QR code on the left, that takes you to the Immunize for Life IFL website, and on the right will be a program that we call a campaign that we call Act of Love, which is an influenza vaccine prevention. We engage with policymakers, which is a must because they make decisions, and we express our expert opinions. We also provide scientific updates and offer and coordinate support for vaccination promotion initiatives. And now what's very important for any program is you need money. In Malaysia, our Ministry of Health and Government is not as magnanimous as Hong Kong, where they can provide funding for this sort of activities. Now, they are willing to cooperate with us, but they are not willing to provide the money because basically money is short supply. And so we have this public-private partnership, which is an efficient utilization of mutual strengths and resources, but we have clear terms of reference for good governance and sustainability. So the terms of reference are actually distributed to the companies, and they know what their rules are, what their limitations are, what our rules are, and that they have to follow it, and what the Ministry of Health expects, and they have to follow that. Now, the advocacy activities include the promoting the national immunization program. We actually wrote an NIP coffee table book in 2021 that actually highlights the national immunization program. We have training for healthcare professionals all over the country on vaccine hesitancy, and also we produce in-clinic materials for parents that are not biased to any particular company. And with regard to the PCV or pneumococcal conjugate vaccine that we introduced in the national program in 2020, it was after 15 years of trying to promote it that we managed to get it in 2020. And 60 million ringgit or about 15 million US dollars was allocated for it, for that program. When the PCV was introduced, we had 2 years later, in 2023, the Ministry of Health decided that they wanted to do a catch-up pneumococcal vaccination for 4 to 5-year-old children, and the Immunize for Life helped them by promoting it, like we made cartoon characters and all that, to amplify the efforts and drive parents to get their children vaccinated. And promoting of additional recommended vaccines, which I said is how we call optional vaccines. So this was a multifaceted program that we actually engaged with, involving videos and all that to promote, as well as face-to-face interactions to promote these additional recommended vaccines or optional vaccines. And then addressing vaccine hesitancy and refusal, we have gone around the country training healthcare professionals on this, but it involved a multi-specialty expert panel, which involves a psychiatrist, a family medicine specialist, and so on, and adolescent medicine specialist. And we published a book that was a guide for addressing parents' hesitant and refusal that we distribute to all of the clinics in the Ministry of Health. And we train the primary care personnel as well. HPV is nothing new. We've been doing this for a long time, but we actually go on a culturally sensitive approach, focusing on cervical cancer prevention rather than sexually transmitted diseases, as had been mentioned earlier by Daniel. So, and now we have introduced the maternal Tdap for pregnant mothers. It's already been introduced since February this year. And that was after a lot of lobbying with the Ministry of Health. And then yearly influenza vaccines is something that we have been trying to get the ministry to buy into. And finally, we managed to get annual influenza vaccination for older persons from this year onwards. So we had 2 new vaccines for adults this year, maternal Tdap as well as the influenza vaccine. And the work after that is for the Immunize for Life to actually promote this idea to the public so that they will come and get it. Pandemic response, outbreak response, during COVID, we actually came up with a lot of videos that are in the website, and also issues regarding vaccine hesitancy of the COVID-19 vaccines, and we had face-to-face interaction as well. Now, Immunize for Life is not the only thing that we use. There's another program called Positive Parenting, which actually targets Malaysian parents, and this we incorporate vaccination into this as well. So we know that vaccination saves lives, but hesitancy and mistrust leave people at risk. And it's not only about fear, but it's about trust, values, and who people believe. And we know that healthcare workers are the trusted voices, but community advocates also make the message stronger, and also religious leaders. And we need a clear, independent, and lasting advocacy platform that connects with people emotionally and logically. And with the right messengers and the right stories, we can rebuild trust, boost confidence in vaccines, and protect more lives across the country. Just to remind again, this is the 10th Asian Vaccine Conference, which will be held in Malaysia at the island of Penang on the 9th to 11th of October this year. And if you are interested in vaccinology, and if you have never been to Malaysia before, or you've been to Kuala Lumpur, but you've never been to Penang, please come. Thank you very much for your attention.